My name is John Flucke. I am Chief Dental Editor and Technology Editor for Dental Products Report magazine. I also serve as peer review chairman for the state of Missouri. And one of the products that I really enjoy working with is the VALO from Ultradent. This is a really great curing light, and in fact it's won the Pride Panel Award for several years in a row now for the best curing light on the market. And it wins that for a number of reasons, and I love it for a number of reasons. Number one is the fact that it is a broadband light. It's wide spectrum, it cures everything on the market, and not all curing lights do that. That means that patients are getting in and out of the chair faster, which really benefits the patients, but from the doctor and the assistant's point of view, you're not in the clinical treating posture as long. And trust me when I say that over the years, what we do does beat us up physically. This device is made out of aluminum, and it's made out of aerospace grade aluminum. So it's incredibly durable. In fact, you can take it and, the majority of your curing lights are going to hit the floor at some time or another, but this one is designed to do that, and yet, it just comes right back for more. Things are going to get dropped, things are going to get banged around, things like that are going to happen. And the durability issue of it is really big. That low profile design, being able to get it where you need to make sure you're curing things properly, is a big issue. Because of that low profile, the patient doesn't have to open nearly as far to get this clear back to get access to a second molar. If you're using a gun style with a long light guide that has a bend on it, the patient has to open a lot further. And for patients that can't open wide enough, that can be a problem to get the light down to where it needs to go. Curing is really important, and there's a lot of physics that goes into curing that we don't think about. If you move away even a millimeter or two, the power of your curing light drops exponentially. And you end up with what I call candy composites, which are crunchy on the outside, chewy on the inside. And that can lead to sensitivity issues, it can lead to bonding issues, it can lead to problems with marginal breakdown and the long-term viability of the restoration. And so one of the big things that I recommend to my colleagues about this particular device is that whether you're curing with it as the doctor or whether the assistant is doing the curing, this low profile design gives you complete and total access to the field so that when you hit that button and cure the composite, you're right where you need to be. My grandpa used to tell me, John, you buy the best, you only cry once. And I do think there's something to that. But when you think about the fact of the durability issues, the problems and the angst that comes with composites that aren't properly cured or properly bonded that lead to sensitivity issues, all those kind of things can really factor into value. And so if you want to do your best, then you use the best burrs, you use the best restoratives, you cut the best preps you can. And in order to cure all that and do it properly, use the best lights you can. And for my money, on the market right now, this is the best light there is.